the opportunity and announce yourself. I would appreciate that you do not listen to this call and not announce yourself if you're from the media. All right? So, but you will have another opportunity to do so without interrupting this. I will ask the media to hold their questions. Anybody that does not have their phone in use, I ask that you hold all questions until the end, please. Again, I'm Jim Wicks, Director of Emergency Management for the City of Westfield. I am partnered with Joe Roush and the City of Westfield Department of Public Health to fight this battle against COVID-19 in our city. We also are very obviously leveraging police, fire, emergency dispatch, and other departments to assist us. We're here today with a few of our key departments and members of our lead team, along with people that are leading our efforts for our community. This is not inclusive of all the people behind the scenes. I do have a few opening comments before I turn this over to the mayor, and then we will go around the table to speak about our portions. Again, I remind you to hold your questions to the end. The City of Westfield declared a state of emergency on March 16th at 2 p.m. This is the third round table we're holding, and the second in this format. Our staff has been working diligently for long hours, 7 days a week, since early March. We have a good operation, trust amongst us, and we're all doing our part in this fight. I will now turn it over to the mayor for his opening comments.
Thank you, Jim. Hello, everybody. This is Don Humison, the mayor of the City of Westfield. Thank you for joining us for another one of our informational roundtables. And as you can see by looking at this chamber, I'm coming to you from the City Council chambers at the state at the City Hall here in Westfield, and the room is empty. We are doing in practice what we hope that you will be doing as well in keeping our social distancing from one another. Everyone who will check in today will be doing so from the phones, so that you'll be able to get a report, as we do each and every day here at City Hall, from the department heads and the people who are working on the front lines of fighting this COVID-19 outbreak and condition here in the City of Westfield, and of course across the Commonwealth and across our country. I'd just like to start with the numbers. 216 as of today, the number of positives for COVID-19 in the City of Westfield. And if you would, for just a moment, pause, and I'd like to take just a quick moment of silence for those folks that we know we've lost here in the city to this disease. Thank you. I think when it started a couple of months, well, more like a month ago, we weren't sure the impact it would have on our city. I certainly don't think a lot of people took it seriously enough to realize that there would be people from our community who would lose their lives to this disease. But that's how serious it is. It's now not just a matter of some people dying. There have been people now that I think each and every one of us in this community know in some way, whether close, by close acquaintance, or just by passing, but we know someone who has lost their lives to this disease. That should be an indication to everyone that this is serious, and it remains serious some 5 weeks into this situation. So we continue to ask each and every one of you to do your part in staying at home. As the weather gets better, I certainly encourage you to get outside and enjoy your time in your yard, but stay away from other people. If you do have to go out for whatever reason, make sure you have a mask. The governor is now giving the advice that anybody who goes out in the community should have a mask on when there are other people, not just to protect themselves, but to actually help protect others from you. So wear your mask when you're with other people. If you have difficulty getting masks here in the city, I think I'll have Jim Wigg speak to that later. We've got a number of diligent volunteers in Westfield working on making masks for people. And obviously, we're making a lot of them available to our first responders first, but there are also masks available to members of the general public. I mentioned to keep your social distancing. Those protocols have not changed. And if for whatever reason you're still interested in knowing what the quote-unquote rules around this disease are, please tune to the definitive source here in the City of Westfield, which is our city website, cityofwestfield.org, cityofwestfield.org. You can pick up a lot of information and other links at that city website to take you to places to get more information about how you can keep yourself, your family, your co-workers, and others safe to this situation. So please visit that site. Finally, you'll hear in just a moment as we go around the room figuratively how many professionals, hardworking and dedicated people there are working behind the scenes as your public servants to try to address this problem. A problem not unique to our city, but a problem that is impacting our entire country and the world. And I hope if you get a chance, you'll say, along with me, you'll have a chance to say thank you to each of those professionals, each of those dedicated individuals who is giving up their time and their efforts to try to keep our city safe. So Jim, I'm going to pass it on to you, and we'll go around the room, give people a chance to hear what the folks in the city of Westfield are doing to combat this disease. Thank you.
Yes, sir. Thank you very much. Now we're going to turn it over to Joe Ross from the Department of Public Health.
All right, thanks, Jim, and thank you, Mayor, for taking probably about a quarter of the things off my plate that I was going to talk about. So that's
sorry about that, Joe.
No, it's better coming from you, so then I can kind of focus on what we're doing here in the health department specifically. So you hit a lot of the good general overall information.
Good.
Throughout the state, I've been talking to some of the other colleagues that I have. It's very well known right now that social distancing and staying home is working. So from some of the early models that we saw, there was a question about, is this really going to work? Are people really going to listen? I can say that just from talking to the state health department as well. The model is, even though we still haven't presumably hit the peak, we are kind of flattening the curve, so to speak. So that's a good thing. So everybody keep up what you're doing. What we're doing here is we have received, like the mayor said, 216 confirmed cases in Westfield. We have been following up with every single one of those cases. By the end of the day, caught up with every single one of those cases. At the end of every day, we have been kept up with all the cases. So, and that's a lot of thanks to, we have 5 school nurses that came on to help us out, so very much thanks to them. We do have another avenue that the state has released, a community tracing collaborative, which will allow us to access some volunteers who are public health students to help distance, and that's been recently. That's been within the past week. So I kudos to them that they're branching out from the east and coming over here, because they're not just Westfield, other communities that desperately need the help. So other than that, I mean, we can talk about the numbers, but the mayor kind of mentioned that already. I will say, if you do the math, and for anybody that thinks that Westfield numbers are excessive or out of whack with the surrounding communities, our cases in Westfield account for 12% of all of Hampden County cases. So that is not out of whack. We are just reporting regularly and accurately. I won't say that nobody else is, because I haven't really checked recently, but I think everybody's getting better on reporting their accurate numbers. So just to put it into perspective, when you see or hear the people say, how bad it is in Westfield, we are right in line with everyone else. And the last thing that I'll say is in reference to the state health department again, is that I have a standing phone call every day with the Assistant Commissioner of Public Health at noon. He calls me to check in to see if we need anything, any more resources, or any help from him to make contact to get us something. So that system is in place. I'm very thankful for that. And, everybody is kind of in the groove right now with this. It's all encompassing. We're here every day, all day. But we're getting it done. So I'll just stand by for questions. Thank you.
Joe, thank you. And thanks everybody in your office.
Right. Hello. I'm Jim Wiggs. I'm the Emergency Management Director, as I mentioned earlier, for the City of Westfield. I am running the Emergency Operations Center. I work very hand in hand with Joe. I try to take things off his plate that are more operational related, that that is a distraction for his department because we don't have infinite resources. I work very closely with police and fire to see what their needs are. Work with MEMA to get supplies. I handle donations, and I'm also working very closely with Tammy Teth in the procurement area for things we need, and for Tammy for some of the contractual things that we're doing, such as making sure we got locations to quarantine people and or quarantine our first responders. I should clarify that. So I work very closely with Tammy. Within the EOC, Nina Barsh is assisting me outside of her normal role as the head of public safety dispatch, and you'll hear more from Nina about what's going on in dispatch. But I also, the mayor mentioned masks. I pick up masks every single morning on the way out of my neighborhood and on the way to work. We've got a system worked out where better than a bandana mask, they leave them on their front porch. We do have the mask makers making masks also, but better than bandana masks. She's leaving them every day on the front porch. And then I worked with the mask makers to make sure we reached out and got donations from Walmart for them to make masks because they were spending their own money, and Walmart made a generous donation. And also we had a private donation for them to get elastic because Walmart had no elastic in stock. So a lot of things are going on. A lot of things are happening. We're getting great support from Mass Emergency Management Agency, but we're nowhere done with this fight. I wish someone could tell me that we're X percentage through, because this is not like the tornado or an ice storm where we get a report from Gas and Electric that says we're 75% recovered. I wish someone could say we're 90% through this, but I don't know anyone that knows that information right now. So with that said, again, hold questions to the end, but I'll turn it over to Chief Eglaw from the Fire Department.
Thank you, Jim. Can you hear me?
Yes, sir, loud and clear.
All right. My name is Patrick Egloff. I'm the Fire Chief of the City of Westfield. I don't really have a lot more to say than what we had a couple of weeks ago. A couple weeks ago, I had 5 individuals that were out either COVID-related, and I know at the council meeting it was brought up that my numbers increased to 10 now, and that is true. But now we're about a week and a half past that, and I currently have about 5 people out. So I'm hoping that's an indicator of where we are with this pandemic right now, because I am slowly but surely getting my people back. That being said, all fire and EMS operations continue without interruption in the city of Westfield and with our mutual aid partners in the surrounding towns that we help to cover, the hill towns and such. Our people, one thing I'd like to say, and I want to say a thank you to Jim Wiggs and MEMA. We are very good right now when it comes to PPE. My people have exactly what they need in order to go and do these ambulance calls for COVID patients. I know that some hospitals in the area had some difficulties, but our emergency management and MEMA together, along with Tammy Teft, which is our purchasing director, has allowed us to go and essentially do our jobs without worrying about the PPE. So we're good with PPE, and I would say we're good at least 3 weeks going forward. I really don't have a worry on that. I do want to say, put a thank you out there to the health department, and specifically one of the school nurses that is volunteering. Her name is Jennifer Chapman. She's our liaison to the health department for both police and fire. And along with Jen and Deputy Chief Ben Warren, they have been able to go and work together to keep my men and women safe and healthy. So we've been able to do things to keep them safe and healthy, mainly because of the work of those 2 people, Jen Chapman and Deputy Chief Ben Warren. Really, that's it. We continue to do everything that we did before the pandemic. I think we have seen some of our call volume come down overall, but the COVID calls continue to be the majority of our calls, if that makes sense. And that's really all I have today.
Thanks, Chief.
Thank you, Chief. Now I'll turn it over to Chief Larry Valier from the Police Department.
Hi, Jim. Good morning, everybody. Chief Valier from the Police Department. We're pretty much in step with the Fire Department. Our mission, as well as theirs, continues to go on uninterrupted. The changes that we made in regards to crime reporting and the smaller adjustments that we made early on in the epidemic have been effective in providing public service and keeping our officers safe. So we also had a spike about 2 weeks ago. We had 5 employees that were affected by the virus. We're pretty much back on track with everybody except one person. Also, I'd like to say a thank you as well to Jennifer Chapman, who Chief Egloff had spoke of earlier. She's also worked closely with our department, and she's been instrumental as well in keeping track of where everybody's at as far as their health. But the department overall is in good shape. We've adjusted our hours and how we do our staffing. It's giving officers more time off, and for us, the curve certainly is flattened here health-wise. So we're happy about that. We have all the PPE that we need. Again, Jim Wiggs and MEMA, as Chief Egloff has stated, have been fantastic about getting us what we need. Our call volume is also down, which makes things a little easier for us. We feel as though we're getting a lot of cooperation from the public, which makes our job again easier. So thank you to everybody, the health department for sure, for their support, and we're good right now.
Thanks, Chief.
Thank you, Chief. Okay, now to Nina Barsh, our Public Safety Dispatch Director.
Hi, everyone, and thanks, Jim. Thanks, Mayor, for having me again.
Thanks, Nina.
I'm Nina Barsh. I'm the Director of the Emergency Dispatch Center here in Westfield, and I have a team of fantastic 911 dispatchers here who are taking a variety of calls throughout the city every day, all day long. They're dispatching out the police and fire just like they would typically, but recently, with every day that passes, we're taking an increasing amount of calls related somehow to the COVID-19 pandemic. So I don't have much to add from when I last spoke in this forum on the 1st, but some things have changed in the way the dispatchers are taking and processing these calls, along with getting all the necessary information we typically would on a 911 call. And before we were just screening only medical calls for any type of COVID symptoms. We've now started just in the past week and a half, I'd say, that we're actually screening all calls for service now. So anytime a police officer, firefighter, paramedic could be going to someone's house, we're going to be screening those callers for COVID symptoms or anyone who's on scene who could have the symptoms. And that main reason is to keep our first responders safe. The dispatcher will also be asking anyone to be coming to the door if it's safe to do so when we're sending a first responder to a house for any reason. And that's just so for the police officers and firefighters, let's say, can ensure that they're properly distancing themselves while they're speaking to you. Then they're also going to be limiting the amount of homes or places that they're going into unless it's completely necessary. I think lastly, I just wanted to, I know I've said it multiple times, and the chief also, the fire chief reiterated it the last time we spoke, but it's so important to please refrain from calling 911 unless it's an actual emergency. And now with texting to 911 available, the dispatchers are just urging people to still call when you can and only text when making a voice call isn't going to be possible. And I will also reiterate what the mayor said earlier, is just keep looking out for new information on the city's website, which again is cityofwestfield.org. At the top of the page, you'll see that there's an alert banner with a link to all reference information on COVID-19. We're keeping that information as up to date as possible for the remainder of this crisis. So, thanks, Mayor.
Thank you, Nina. Appreciate all your work.
Thank you.
Nina, in addition to being a public safety dispatch director, I mentioned earlier that she's also assisting me in the EOC, and I gave her the role as the communications lead. So she basically helps me make sure she takes the lead on making sure every day that we've got our stuff posted on the website, social media, so forth and so on. It takes a tremendous load off of me, and I focus more on the MEMA side of the house. And speaking of MEMA, they actually called when I was on this call, and I'll be calling them back. We do a check-in every single day. Hats off to Massachusetts Emergency Management Agency and the relationship we have with them. Continuing on, community relations. Stefan, if anyone doesn't have their phone on mute, please mute. I'm hearing a lot of background noise. Community relations, Stefan, you're up next.
Good morning. This is Stefan Zaporowski, Superintendent of Schools. Our update is just that our remote learning has progress, and any students and parents that have questions should email their teachers and building principals. Last week, we distributed, with the help of the Tech Center, over 1,400 Chromebooks to support our remote learning plan, and we have over 300 additional requests, and these families will be contacted about a pickup date and time either later this week or early next week. And I also want to remind families that we will continue to provide breakfast and lunch Monday through Friday through the duration of the closure. And so that includes if it gets extended. And I know we are up to 800 to 900 meals a day now. Serving out of South Middle School from 11 to 1, Franklin Avenue Elementary School from 11 to 1, Edgewood Apartment from 11:30 to 12:30, Mill Village from 11:30 to 12:30. Know that the Boys and Girls continuing to provide dinners at those same locations, including the Boys and Girls Club at Street. That's all I have for today.
Thank you, Stefan.
Lieutenant Bard, anything to add?
Yes, this is Kevin Bard, Lieutenant of the Community Service Unit for the Westfield Police Department. A couple things. We've become the conduit for providing meals for the soup kitchen Sunday through Friday on behalf of a generous donor. We are also, Kathy Catuno had made mention to me, she's the director of the Greater Westfield Core Group, and apparently there is a certain demographic in Westfield that single-parent households where the parents one of the parents go off to work, the children are left at home for a better part of the day. I've reached out to the school superintendent and Bill Parks. They're both on board to provide breakfast, lunch, and dinners to these families throughout the city. So I have Kathy Catuno working with me, with her volunteers, to get a hard count for the number of families that are in this population, so we can provide meals to them. And then, last but not least, we've also been assigned to assist the Board of Health for any violation of the city's and state's restrictions in regards to non-essential businesses as well as essential business. And then I have an email from Tina Gorman that we just wanted everybody to be aware of. They're distributing 200 brown bags of groceries curbside for our monthly food distribution program. As soon as we funnel the participants through the parking lot first thing in the morning, we'll have lunch, crowd lining up behind them. All this is with a skeleton crew and as few volunteers as possible. We are now averaging more than 100 meals per day for the senior center curbside pickup. We've learned that some of our most at-risk elders are temporarily staying with family. This is a huge relief. We are fielding phone calls from both family members and older adults residing in some of the Westfield senior housing complexes. They are concerned with outbreaks, oversight of the sanitizing of common areas, and residents who are symptomatic but have not been tested. I have encouraged them to contact the health department, and that was an email sent from Tina Gorman from the senior center.
All right, thanks, Kevin. That was great. Okay, with that said, Mayor, do you have any comments before I start the media roll call again?
No, go right ahead. Let's hear what the questions are.
All right, I got Westfield News. I've got the Republican. Is anyone else from the media that's joined this call that haven't announced themselves?
Amy
Sarah.
Phillips, 22 News.
What
Oh,
was your
good,
name
welcome.
from 22 News?
Amy Phillips,
Hi,
22
Amy.
News.
Okay, and someone else was speaking up.
Sarah Brunelli from Western Mass News.
Hey, Jim.
Okay, anybody else from the media? I've got 22 News, Western Mass News, The Republican, and Westfield News. Yes, Mayor.
Jim, I also have Representative John Vilas is here with us as well.
All right. All right. Anyone else from the media? All right, Representative Vilas, before I go to the media, do you have any comments?
Yeah, well, first and foremost, thank you to everybody in the city with everything that you're doing, and I really appreciate these updates. I think they're great. I'll just give you a quick tidbit from the state and kind of what we have going on here, what I'm seeing on my end. The best way I think to probably articulate what I'm doing is, we're dealing with a lot of the secondary effects, if you will, the financial stuff, the economic stuff that's happening as a result of this. We've got a lot of Westfield folks and beyond, obviously, throughout the Commonwealth, but my office in particular, unemployment claims through the roof. The volume it's continuing to come in. It hasn't slowed down at all. Rob's trying to do everything we can. A lot of the small business aspects right now, trying to navigate many of our small business owners to appropriate relief and remedies with some of the loans. There's many state ones, federal ones, and I know the city's got some things out there too. And I guess I would just say this regarding the budget, fiscal year 2021. We had a Ways and Means hearing yesterday, essentially where we brought in some of the economists from all over the state and beyond. And I guess I'd just say this for purposes of right now. This is going to be a very difficult budget cycle. Revenue is obviously down. Sales taxes aren't coming in. The income tax, the deadline's obviously being extended. We are in for a very difficult financial and economic time period in the Commonwealth here. So really, obviously, pending any questions on any of the state stuff, but kind of the update from the state for right now.
Representative,
Thank you, Representative.
I was going to say thank you for that, Representative. I also wanted to mention that because of some legislation that the House and Senate passed and the governor signed, it gave mayors like me a chance to extend the deadline for real estate taxes and personal property taxes here in the city. So we're going to extend our deadline to June 1st. I think a robocall went out on this last week. There's also information at our city website about that, so that folks who have not yet paid their taxes here in Westfield know that they have until June 1st. The deadline will not be extended past June 1st, but at least it's at June 1st right now. Also, I've been meeting with department heads about our own city budget, and it's very similar to what you just said, John. The budget here locally is going to be very difficult as well, partially because the revenue won't be coming in from the state to the cities and towns, but partially because, of course, the impact of COVID-19 on our own businesses and our own economy here in the city. It's going to be a difficult year. So we're going to have to, tighten the belt a little bit and hopefully get through this. Obviously, the shorter this disease can last, the more likely it is that our economy will rebound quickly, and that's what we're all praying for. But the impact has been pretty devastating. So we feel for the people who've been impacted by it here in town. But again, thank you for your information.
You're welcome.
Appreciate it.
Excellent. All right, so we'll start to the media. And if I ask the media to listen very careful to the questions, so you don't ask the same questions. We're going to try. I'm going to try to make sure that we're wrapped up on the hour, so we have a half an hour if we need it. But we want to try to contain this to an hour, so our key personnel can get back to fighting this fight. So I'll start with the Westfield Evening News. Hope, do you have any questions?
I do. Thanks, Jim. I was wondering if you could actually add some more detail to the funding and use of students for public health.
Yeah, sure. I can. This is Joe from Health. I can talk to that. So the funding, well, it's not costing the city anything if that's what you mean. So This is all funded through the state health department, and there's two different things that they're doing. They are offering public health students that are actively engaged in their studies to kind of as part of coursework, if lack for a better term, to help us out to do some of the tracing. And then there's another one, what I had mentioned, the Community Tracing Collaborative, which eventually every city and town in the state is going to be part of. And that will kick in some automatic sort of case investigations if those cities and towns aren't able to get to them and they're spilling over. But as far as the funding goes, it's not of any cost to the city of Westfield.
Okay. And is that something that's being implemented already, or do you have a date for when you're going to start? And do you know how many students, and are they local?
I don't know if they're local. It all goes through the state, and and they're not going to be boots on the ground necessarily. This will all be remotely by phone and computer. We have already started, just as of yesterday, sent out the message that we want at least one of those public health students. The Community Tracing Collaborative isn't in full force in effect yet, but I would say by next week, everybody should be hearing from the state on that, and as far as whether you want to buy in on it or not.
Thank you.
You're welcome.
All right, this is Jim again. Just so the panel members know, every question Joe Roush will either speak to or he'll deflect it to each of us to answer. But take a pause, though, if you get asked a question, I'll let Joe make sure, because this is a public health emergency, that it's an appropriate question to be answered by us versus him. Republican, do you have a question?
Yes. How many deaths have there been so far?
That's a good question. I knew somebody was going to ask that. So I can tell you that we don't have that number right now. And the reason is because it's not a number that we are routinely provided with by the state. It's different than the way we get our confirmed cases, which is through a surveillance program that's a statewide database sort of thing. So every morning we'll get a new case number for confirmed cases. They do not provide us in that same system with the death numbers, just because it's just not something that comes through in the same way. So I can say those numbers are out there at the state level. They're reporting them back as county numbers, deaths. But as far as the city of Westfield goes, we don't have those accurate numbers right now.
Thank you. And how does the tracking system work?
It's an actual communicable disease database or program software that's used by every city and town in Massachusetts and has been for years. So this isn't the first communicable disease we've ever seen, believe it or not. So the system has been in place forever, and that's the way that we get, at any city and town gets any report of whether it's a foodborne illness or some other reportable disease. So the information gets entered in from the provider and then to the state, and then it's disseminated to us in that way.
Okay. And what do you know about the post office? Do you have any information on people who have contracted the disease at the post office?
The last I heard was what was reported, and then there was just dead silence on this end. So last I heard, there were 3 confirmed cases in the Westfield post office. We haven't really received any calls on that since. So we did do some case follow-up on at least one of the cases who was a Westfield resident that worked there. But since we initially heard from, it was employees calling and complaining that somebody had been confirmed and nobody was doing anything, we shored that up, and ever since then I haven't heard any word back. And I will also say right now to everybody, we do have on the line our supervising public health nurse, Deborah Mulvena. Right now, after what I just said, I'm going to ask her to confirm what I said was true.
Yes, hi, this is Deborah Mulvena.
Hey, Deb.
Yes, we haven't heard any more regarding the post office situation. We followed up with contacts, and they were notified, and everybody was quarantined as appropriate, and I've received no more calls on my end.
Okay, thank you very much.
Thanks, Manon.
Okay, 20 News. Do you have any questions?
Yes, I do. The first one is, you touched briefly on masks available for the public. Do you know where they can get them?
Jim, I think that's a good one for you.
Yes. They can contact the EOC through WEMA admin, that's WEMA admin, ADMIN at cityofwestville.org, or they may call 413-568-1222, 413-568-1222, and press 4 and leave a message, and I will make arrangements that they can either pick a mask up, or if we have someone going that way that picks something up, drop it off to them. They can also reach out to the mask makers on Facebook and let them know that they need masks and make arrangements to get the masks. I'm in the process of working a better distribution system, like a reverse fundraiser, where instead of people standing there asking for a donation for, to send someone out on a band trip or anything that they do these fundraisers for, that they're passing out masks. We'll do those at some of the high traffic areas. Once we have a few more masks in our stockpile, we'll have people say outside the Big Y and Dunkin' Donuts and things like that to get masks out. But if they need them now, reach out to WEMA admin at cityofwestville.org, or that phone number 413-568-1222. Press 4, leave a message. Thank you.
Oh, okay, thank you. And I have another one on the Western Mass Hospital. What are you hearing about cases there? They're not talking to us.
Joe, you want to take that one? If you know the answer.
Yep, sorry. I don't have specific information on that. Deborah, do you have anything to address that with?
Hi, yes, this is Deborah. Can you hear me?
Yes.
Yep.
Okay. We're doing very well at Western Mass Hospital. We did have a report of a case at the very beginning of all this, and we've had no more cases since. I'm in contact with the Western Mass Hospital regularly, and they were able to isolate that person, and we've had no further issues with that. Right now they're doing very good, and families have been notified, and there's no further follow-up at this point with them.
Okay, and I'm sorry, I didn't get your name, Deborah.
Deborah Mulvena. I'm the supervising public health nurse with the Westfield Health Department.
Okay, thank you. Okay.
All right.
All right. That's it for me.
All right, thank you. Western Mass News, do you have any questions?
Yes, I was wondering, other communities seem to be requiring that people wear their masks when they go into stores. Is this going to be a requirement in Westfield too? I heard you were encouraging people, but are you thinking of making it a requirement?
Yeah, so I can answer that. And then if anybody has anything to add after me, feel free to chime in. But I'm going to look at that right now. I want to make sure that people have the good information about the wearing of masks, and that it's not the be-all to end-all, that it's not going to give them that false sense of security. It certainly will help. It can't hurt. I would totally advocate for people to do that. However, as far as making it a requirement, I need a little bit more information to see about the efficacy of the masks themselves. We know that it's more of a preventative measure, like as far as you as an asymptomatic person not passing along your contaminated droplets to someone else. But I think as a protective measure, people need to understand, really get the message out before we do institute a policy on it, that it's not the overall protection that you're going to need. So in other words, don't go out wearing a mask feeling like you're not still going to have to abide by the protocols.
Thank you.
All right, is any other media on the line besides the Westfield News, the Republican, 22 News, and Western Mass News? All right. Does any of the media have any additional questions? I'll start Westfield News. Do you have any follow-up questions?
Not at this time. Thank you, Jim.
You're welcome. The Republican, do you have any follow-up questions?
Nope, none. Thank you.
22 News, do you have any follow-up questions?
Yep, quick one on the brown bag lunch program for the senior center. Is that once a day?
The brown bags one's one.
I don't know who wants to jump in on that.
That's a monthly program, according to Tina. It's a monthly food distribution program that they do. It's because they're looks like it's bags of groceries. It's not a brown bag lunch, so it's groceries, and it's a monthly distribution program
Of groceries. Okay, thank you so much for clearing that up.
You're welcome. That's per Tina's email that she sent to the Community Relations Group and to me.
Okay.
Western Mass News, do you have any additional questions?
I'm all set, thank you.
All right, and I'm not sure, did I call on 22 News? Any additional questions?
No, all set. Thank you.
All right, I hope that the media finds this helpful. We're planning to do this on a biweekly basis, so if you want information, this is we're doing this basically because of it's easier than interrupting of interviews and stuff, and a lot of the things that we get questions about are and you know rumors are no good, but we can't stamp out every rumor or every time somebody goes on a rant on Facebook and wants to stir the pot. But we do want to get the information out to you. Mayor, I'm going to turn to you. Joe, do you have any closing comments before I go to the mayor?
Yeah. I just wanted to say, I wanted to really thank the residents that have stepped up to do the right thing. That's the majority of people. So like you said, Jim, when you hear the negatives about, the people running amok in the community without masks and buying non-essential things, okay, that's not the prevailing behavior. So we have had great cooperation with people that we've sent quarantine letters to, and so I want to say to them, thank you for abiding by those rules and restrictions. And also to just say that, I'm being cautiously optimistic now that, everybody is kind of in their groove and we're staying in our lanes and everybody's helping each other internally. So, but still, we are in a widespread, sustained community-level transmission. I just want to reiterate, nobody let your guard down yet. We're not ready to do that. And remember, it's not the cases that you know about, it's the ones that you don't know about that you're at the highest risk of getting infected from. So take that to heart. But again, thank you to everyone who's helping out, and thanks to the residents that are doing the right thing.
And before we go to the mayor, I want to add one thing to that is, everyone, please remember to check on your neighbors. If you know you've got a neighbor that is homebound or is elderly, please check on them. And also, even if you don't have a neighbor that's homebound or they're elderly, if you don't see some of the normal activity going on, it doesn't hurt to ring their doorbell, step back 6 feet, and just make sure they're all right. Because Westfield is a community, and it's time to show a little love and concern for your neighbor. So please do so and help us get through this fight. And I applaud what Joe said about the people that are doing the right thing. Please continue to do so. You can help us. And the first line of defense is the individuals themselves doing the right thing. With that said, I'm turning it over to the mayor for closing comments. Thank you.
Thank you, Jim. Thank you, Joe. Thank you to all the people who participated on the call today to help get information out there, both to our friends in the press, but also to the folks from Westfield who will watch this later on, either on Channel 15 or on the city website, cityofwestfield.org. As Joe said, we want to say thank you. Thank you to the people of the city who have actually been doing it right, who've been abiding by the the protocols and the requests from the folks here at City Hall and the folks at the State House and the folks at the White House to do the right things that we need to do to flatten the curve. And also, I want to say thank you again to all the first responders and every unsung hero out there who's providing a lunch to someone who needs it, who's helping to teach a kid, who's maybe at a daycare right now, who's stocking a shelf at a store, who's doing any of those things that we don't think about, but continue each day that this goes on. So on behalf of the city of Westfield, I personally say thank you from me and my family and the people that I enjoy working with here at City Hall. Thank you for all your hard work in keeping us safe. We've gone through this for about a month. Who knows how much longer it'll be, but we are hearing that we're about to enter the toughest part of that time schedule. So let's not let down our guard. Let's keep doing what we've been doing so well. And with any hope, as the weather improves and the days get longer, this disease will go away and we'll be able to return to normalcy. We want Westfield well. We want you well. Thank you for what you're doing, and keep up the good work. And thanks again for everybody participating today. Have a good afternoon. Take good care.